All right, so we sort of know what we want to assess now in terms of the evaluation. What are the outcomes that we want to look at, but how do we go about doing it? And that's a question that's often very complicated, and you know, sometimes takes lots of different angles. So we're going to look at that now. So the evaluation design is essential, and you really need to know what you're examining. Okay, so what questions are you asking and what are those desired outcomes, which is why it's important to look at that program logic and really map those. What were the activities, what were the outcomes, because that desired outcomes determines what sort of methods that you're looking for. So if you're looking for wanting to know community acceptance of a program, you're going to use a very different method than what you are if you want to know what the blood sugar levels are of a certain population. And it builds on that program logic using each step. Okay, so we want to know inputs, outputs, and really defining those questions. And those questions then guide what methods that you use and what indicators that you're going to then report on. Okay. So it involves defining specific questions, and again, that comes up with what we talked about before. Oh, this is a double slide. I didn't mean to do that. Sorry. So what data do you want determines what those is determined by those outcomes that we talked about, and what you need to think about is, are you going to be wanting quantitative data? Are you going to be wanting qualitative data? How are you going to be reporting the data? That's in that dissemination as well. Are you going to be reporting it to lay public and community? Okay, so all these sorts of questions need to come about in this sort of important decision-making process. So you've got your objectives that you've just mapped out. You then know that you're wanting to look at specific quantitative data, or you're wanting to look at more community input, and then you also determine how you're wanting to disseminate it. Then you can move forward with designing how you're actually going to do the evaluation. Okay, and this is just quite a good little tool I found that sort of helps with that process. So you've got your evaluation question or those outcomes that you've got, then you've got the methods, so the tools. So, and we'll look at these a little bit more in a minute, but is it going to be a survey based? Is it going to be interview based? Is it going to be, you know, data linkage? What sort of tools? And where is the data source? Okay. And then also, how often is the data available? Are you going to need to go and be routinely collecting this yourself? Because this comes back into that whole sort of budget of the project as well, resource time, all those sorts of things. Or is it something that you're able to collect quite regularly from mandatory reported data? You also, the baseline, mid and final looks at those different types of evaluation. So the baseline is that formative evaluation, then the mid is that process, and then the final is that summative. So tracking it through the time, and then how you want to present that at the end as well. So I thought that was just quite a nice little tool to map out when you're starting to think about how and what sort of data you want to use. So when we come back to designs, it's a little, they're similar to sort of research designs and thinking about how you want to go about it. And again, that comes back to that evaluation question and those objectives. Okay, so are you wanting more of an experimental design? Are you wanting to have a more of a clinical RCT? So this group experienced this healthcare service and this group didn't experience this healthcare service. What was the difference in their outcomes? Okay, so or this group were exposed to this sort of health intervention, and this group wasn't exposed to the health intervention. So that's that more classic RCT, experimental design. Then you've got, excuse me, quasi-experimental. So this is more looking at whole populations or whole community groups, and it's taking it away from that individual assignment or random individual RCT assignment. Still trying to look at populations separately, so but we can't call it the RCT the pure. It isn't a RCT in its purest sense. So you're looking at, so did this population in this state, which was exposed to this health intervention, have the same outcomes as this population in a different state that didn't have the intervention? And then obviously all your different types of observational designs and looking at your cross-sectional surveys, your case studies, and looking more from that observational perspective. How do we then implement those designs and look at actual data collection methods? So we're looking at our quantitative methods, if you're maybe looking at more RCT methods, so, or it could be observational, cross-sectional, using your survey information as well. So you've got your quantitative information through various surveys, and that can be something simple as program satisfaction surveys for participants. You might be looking at food frequency survey information. How often have they eaten fruit and vegetables, and what's their dietary composition? It might be looking at exercise surveys. So, you know, really applicable to whatever aspect. The thing to remember with a lot of this evaluation is that you're not just evaluating often the actual intended participants, but you also might be surveying the actual processes and systems in place. So you might be surveying the staff or the community, local council members that were involved in implementing the project, and those different stakeholders in the system that you can then look at surveying as well. Looking at blood biomarkers, and then of course epidemiological data that you can then run some of those more traditional statistical methods and modelling on to see what the effectiveness was. Was there, you know, was there a statistical change in the weight, or was there a statistical change in the blood marker? Then, of course, we know that qualitative is just as important, and particularly if you're looking at process evaluation in terms of how is the process going, what's happening, what could be done better, is it really not appreciated by the intended group? Why not? We don't know that if they're just ticking that cross box to say that no, it's time consuming and they don't want to be involved. So, of course, you're looking at interviews, either face-to-face or telephone interviews, and then focus groups predominantly in that. Another aspect too that we can tie into this often is data linkage. Okay, so you might look at qualitative interviewing of a group, but then they might have using mandatory reported data such as cancer surveillance or screening data information. You then might be able to link that to the health of that person. So looking at how many times they have screened, and then if they've had a breast cancer diagnosis or not, and a whole lot of different linkages like that can also give you an indication of within that population. So if we look back to that quasi-experimental, you might be looking more higher level at, say, this population group has a high screening rate and they have a low cancer rate. And is that pre or post that intervention? So you can start to link a lot of those different data collection methods together to paint a bit of a picture on how effective the public health messaging and campaigning have been. An classic example of using data linkages on big population base at the moment is showing that tracking how successful the plain packaging has been on smoking uptake and decrease and lung cancer rates across Australia. So linking all that data is giving us a big picture on how effective that policy has been. And this was just a nice little table that summed up how you can get all this data, how, you know, all the different aspects you can look at. You can look at interviewing the clients, the staff, the partners, the general public, the community, the funders, you know, endless aspects that you can, and the more comprehensive this is, the better the evaluation is. You also can maybe, and this might be applicable to you when you're on placement and observing, might be joining a meeting, a program meeting, and observing, you know, what people are saying in that program meeting. Are staff complaining about how you know, inefficient it is, or how the recruitment's been slow, or all these sorts of things. And then also you might be looking at analysing different documents, or you might be looking at, and a big one that's becoming part and parcel of this evaluation process is also evaluating social media sites. Okay, so how much is the messages that you're trying to infiltrate into these communities being taken up, or is it being met with resistance? So that's another way of an online resource that's quite good to map and track blogs and those sorts of things. So obviously with all these different data collection methods and methodologies, there is, you know, pros and cons of them all. And so looking at and acknowledging the advantages and disadvantages of these is important in the interpretation of your results and the dissemination of your results. And we'll talk about that a little bit more in a minute, but, you know, personal interviews can come back to a little bit of selection bias. Are the people that are being interviewed are the ones that are motivated in the first place to actually participate in the programs? Are you not capturing the people that really don't want to participate in the program by doing that? But it is also, you know, costly at times, and also, you know, it mightn't be the most rapid method where telephone might be better. So I've sort of listed a few pros and cons of all these here, and you can have a little bit more of a look at those as well. I won't spend too much longer talking about those, but being mindful of, you know, selection bias, also with survey data, how limiting survey data can be at times, you know, loss to follow-up in terms of patients or people that you had sent surveys to that might have completed one, but then you followed them up 12 months later and they didn't complete the survey again. Is it better just interview them face-to-face? And a whole lot of those different limitations with the data. All right, so for our final activity today, so thinking right back to that food coupon intervention again, what I want you to do is sort of work through these components, so from an evaluation perspective. So but thinking this table sort of flips it around a little bit. So we're wanting you to think about what is the evaluation focus. What are you going to pick to actually focus on evaluating? What was your evaluation question? And then what would some of the data methods and sources that you might use to implement or to obtain that information and complete that evaluation? So I'll just give you probably 10 minutes for that. So I'll just exit out and break you out again. We're losing more and more people. We're down to 4 people. You'll be in groups of 2. Do you want to stay as one big group and do it? No, I'll break you out into groups. I think you prefer to be, I get more chat when you're just on your own without me. So I'll break you out and then we'll go from there.